Maslow's hierarchy of needs will help you answer many prioritization questions. It has 4 steps. Step number 1, do you have a mixture of physiological and psychosocial answers? Step number 2, eliminate all psychosocial answers. Step number 3, the remaining physiological answers, ask a question. Do they help with the condition? Are these answers related to the patient's problem? Yes or no? If they are not related to the patient's problem, you can eliminate. If they are related to the patient's problem or help solve the patient's problem, then keep it as a possible answer. Step number 4, apply ABC if appropriate. Doing these steps in order is essential to selecting the correct answer. Let's practice a question together using the Maslow's hierarchy of needs prioritization strategy. A nurse is preparing the plan of care for the client with a closed fracture of the right arm. Which problem is most appropriate for the nurse to identify? Number 1, risk of ineffective coping related to the inability to perform activities of daily living. 2, risk for compartment syndrome related to injured muscle tissue. 3, risk for infection related to exposed bone and tissue. And number 4, risk for complications related to compromised neurovascular status. As you can see, you can apply the Maslow's hierarchy of needs strategy. Answer number 1 is psychosocial. Ineffective coping has to do with psychosocial integrity. Risk for compartment syndrome is physiological, risk of infection is physiological, and risk for complications related to compromised neurovascular status is also physiological. So let's use Maslow's hierarchy of needs. Step number 1, already done. Step number 2 says eliminate any psychosocial answer. So answer number 1, bye-bye, eliminate it. Now we have 3 remaining physiological answers. Let's go to step number 3. Do all the physiological answers make sense? One of them does not make sense. Answer number 3 can be eliminated. Why? Read the question. It states a closed fracture of the right arm. And answer number 3 says risk for infection related to exposed bone and tissue. This answer does not apply because the question stem states that the patient has a closed fracture, not an open fracture. Number 3, bye-bye. So now I have answer number 2 and answer number 4 to identify which one is the most appropriate. We can eliminate answer number 2. Compartment syndrome is one of the complications that this patient can experience. However, answer number 4 not only includes compartment syndrome, but also includes other neurovascular compromise situation. Answer number 4 says risk for complications. This is a general statement. Complications include compartment syndrome and other complications as well. Therefore, answer number 4 is the correct answer.